Hello, everyone. Greetings, everybody. I'm Priyanjali from a beautiful Spotless Skin team. I'm sure all of you must be keeping good health. Welcome, everyone, to our special Instagram live session. In this live, we will be shedding light on a condition that affects millions worldwide. Acne isn't merely a surface issue, it can deeply impact one's emotional well being. Beyond the physical blemishes, it can erode self confidence, leading to anxiety, depression, and social withdrawal. Acne vulgaris is a chronic condition affecting more than 85% of adolescents and young adults. Yet, despite its prevalence, there are still widespread misconceptions and stigmas surrounding acne. That's why in today's live, we are aiming to dispel myths, promote understanding, and empower individuals to seek effective treatments. Today, we are diving into the topic acne management with our skin expert, whether you are struggling with breakouts yourself or simply curious about maintaining clear, healthy skin. This session promises to be both informative and engaging. Today, we are honored to introduce Dr. Nandini Shetty, a renowned skin expert from Dombivli. Dr. Nandini Shetty, MBBS, MD, Dermatology, Venerology, and Leprosy, is a compassionate and dedicated dermatologist with a keen interest in both clinical and aesthetic dermatology. She completed her MD at Bharati Vidyapith Medical College, Pune, and further specialized with a DNB in dermatology. Dr. Shetty has gained invaluable experience as a senior resident at Bharati Hospital, Pune, where she provided comprehensive patient education and managed a variety of dermatological conditions, including emergencies like Steven Johnson syndrome and erythroderma. Her academic pursuits include observationship at prestigious institutes like Cornell University, where she gained exposure to melanoma and non melanoma skin cancers under renowned dermatologist. Dr. Shetty's dedication to her field is further highlighted by her contributions to dermatological research with multiple publications in national and international journals. Her skill set spans across dermatosurgery, pediatric dermatology, and aesthetic treatments, making her a versatile and trusted professional committed to enhancing patient care. She is currently practicing at Traya and has her own clinic at Dombivli named as Dr. Nandini Shetty Skin Clinic. And with that, we would like to welcome her to today's platform. Very, very welcome to you, Doctor. The first question, the general question for you would be what is acne and how does it look like in the initial stage?
Okay. Good afternoon, Priyanjali, first of all, and thank you for such kind words. So, yes, and I'm delighted to be the part of the session today. Okay. So, yeah, your first question was regarding just a minute, regarding acne and yes, what exactly is acne? Okay. Just a minute. Yes. So basically, in medical language, what we define acne as, it's a chronic condition involving the pilosebaceous gland. Okay. Now, pilosebaceous gland is a lot. It's like a very like much of a complicated medical term, right? So, in simple words, what exactly is this? Is that now in our body, our entire body is covered with hair follicles. Okay, so this hair follicles that's there. Okay, it's there in each and every part except the palms and sole and mucosal surface. Okay, now over the other parts of the body, okay, like on the face and everything, this hair is not very much noticeable because it's been kind of like a very thin structure that is usually not like not noticeable at all. Okay, but it's still there. Okay, now, the hair structures that involve the face, neck, chest, shoulders, and back have a gland, what we call as sebaceous gland. Okay. Now, the sebaceous gland has got this translucent lipid or what we call as oil-rich fluid, what we call as sebum. Okay. Now, the sebum is what is the thing which is involved in acne. Okay. So in acne, what happens is that this secretion during the time of usually the puberty, before puberty, this is a very like this gland is underactive, not working. Like it's like it has a very minimal function. But as soon as a patient gets puberty, what happens is that this gland becomes hyperactive with the hormonal changes. Okay, and because of the hormonal changes, the thing is that because it becomes hyperactive, the sebum is produced excessively, and because the sebum is produced excessively, sometimes there is this blockage that happens. And because of the blockage that happens, now there is this bacteria that's present all over our body. That's a part of our skin. Okay, this bacteria, the way we like to gobble up the oily food, oily junk food, and everything, this bacteria also loves sebum. Okay,
Hmm.
so because of this, the sebum being lipid rich and everything, it becomes a perfect spot for this bacteria. Okay, to thrive and everything. Because of which we get this localized infection over that spot. Okay, and because
Right.
of this, there is this inflammation that's seen. Okay, now you were talking about the type of skin lesions, I guess. The
Right.
type of skin lesions that's seen in
Right.
acne, right?
Right. Right.
So, based on the structure, whether the inflammation is involved or not, there is two types. One is inflammatory, one is non-inflammatory. Non-inflammatory is the one which is seen in the initial stages. Okay, so the non-inflammatory acne is first of all basically the comedones. What we doctors call as comedones is basically blackheads and whiteheads. That's blackheads and whiteheads. That's the part of our that's seen on the face and everything. Okay, so why is one
Hmm.
called as blackhead and why is another called as a whitehead? Okay, so in medical language we call this as open and closed comedones. Okay, so basically, what happens is that the sebum, when it is not exposed to the air, is a translucent structure. So that's the reason it's called as whitehead. And when it gets exposed to the air, then it becomes a blackhead. So that's why. Okay. Now let's talk about the inflammatory lesions at sea. We call it as papules. So basically, the zit in common language, what we call as zit, is basically a pimple, what we call in medical language as papule. Okay, and when there
Hmm.
is this crown of pus that is seen on the top of a zit, it's we call it as pustules. Okay, that's simple.
Right.
Next is nodule and cyst. Okay, so for layman's language, we can say it's a deep-seated infection. Okay, so
Hmm.
basically a zit which is very deeply located.
Right.
Okay, yes. So that's the
Right.
type of,
So,
yeah.
right. Doctor, what about acne prone skin? We know a lot of people does have it. So, what can be the reason behind it, the cause behind it?
Okay, so as I was saying, ki during puberty, a lot of hormonal changes happen. Your hormones
Hmm. Hmm.
become very much activated during that time. Okay, because of
Right.
which these glands are suddenly activated. Okay, and there's this shoot up of estrogen in females, shoot up of testosterone in males that happens, and because of which the skin suddenly becomes suddenly starts secreting the sebum and suddenly it becomes oily. Okay, suddenly,
Right.
what in some people what happens is that now what we call as hormonal acne is what happens is ki their hormones are not very much regulated, what we call as dysregulated. Here also
Hmm.
the skin starts producing a lot of sebum. So here what we
Hmm.
call as seborrhea. Okay, so sometimes
Right.
it can be associated with a sticky kind of dandruff, what we call as seborrheic dermatitis. Sometimes it can be associated with growth of facial hair. Okay, so that can be
Hmm.
associated. Sometimes it can be associated with other hormonal imbalances also,
Right.
etc.
So, what are the areas which are normally affected by acne?
Okay. So usually the typical acne, as I said, the best, the age group that we see is usually the teenagers. Okay. So
Hmm.
usually these pimples are usually present over the cheeks, most of the common,
Hmm.
it's the most common location. Other than that, forehead. Okay, so
Right.
that's a common location, and it's like a morpho. Everything is mixed. You can find at one place comedones, at one place you can find what we call as zit and like papules, pustules. Everything can be seen. It's but they are in different
Right.
stages. Okay,
Hmm.
that's
Hmm.
the typical characteristic of a teenager acne. Okay, but
Right.
there's one more pimples like that is involving the lower area of the face. This is what we call
Hmm.
this is a characteristic feature of hormonal acne. Okay.
Hmm. Hmm.
So
Hmm.
where
Hmm.
the pimples are located over the lower head area of the face near the jawline. Okay.
Right.
And another one which predominantly involves only the forehead is what we call as acne pomade. Okay. This is kind of pomade is basically something that is not very common in India, but in US and in
Hmm.
all countries where people have got curly hair, they use it
Right.
to defreeze the hair. Okay. So because of which sometimes what happens is that it drips on your face. Okay, because of which you
Hmm.
get
Hmm.
this pimples over this region. So this is kind of a
Right.
characteristic of forehead pimples. But the thing in India, what we find is like a lot of patients apply a lot of oil. We love chumpies, right? Applying a
Right.
lot of hair on your scalp and everything, right? So sometimes in
Right.
teenagers, especially the school going girls, because there's this compulsion of applying oil in the school and everything, so they get these
Mm-hmm.
pimples over their forehead. Yeah.
Right.
So
Right.
that's
So
something very
this
much.
so we get to see these irrespective of any gender, right?
Most of the times, yes. But the thing is that now we find, like we dermatologists, it's been found that in males it's kind of little severe as
Hmm.
compared to females. But in
Hmm.
males, after puberty, it usually settles down. While in females, nowadays, because of PCOS and everything, it has become very common to get pimples over
Right.
the lower area of the face and everything. So females are the long
Right.
sufferers.
So are we saying that specific area, like lesion in specific area, has specific cause behind it?
See, in teenagers, I would like not much focus on, unless it's like she has got like seborrheic, like she has got this acanthosis nigricans, she's obese, she has
Hmm.
got facial hair and everything. I won't focus much on the lower area of face pimples, okay? But
Right.
as she grows, like as a female grows older, after the age of 24, 25, the pimples are not resolving. Sometimes it can happen actually. Sometimes the normal pimples
Hmm.
can, because of genetic component, cannot resolve. But if
Hmm.
she has got a pause of like of many years where she did not get any pimples and suddenly one day started getting pimples over the lower area of the face, I usually warn my patients that there is a impending hormonal imbalance that's there. It might or might
Right.
not affect your periods at this moment, but it can.
Right, right. Doctor, we love clear skin nowadays. There is something in the air that everybody wants a glass skin, irrespective of any gender. I have a lot of male friends who literally they like talking about skincare. कि क्या लगाया बताओ इसके बाद क्या apply करें. Oh, these are the products you are using. How do you use it? Well, they are fascinated to know that girls apply such kind of, especially when they see some girl having a good skin. They everybody wants to know that what are you applying. So what for patients who are suffering from acne, what kind of skin regime should they follow?
See, one thing that I always see right now is that we tend to complicate our regime. Okay, in
Right,
order,
right.
we try to aim for a very clear skin, but end up getting
Hmm,
worsening our pimples and everything because of following
absolutely.
this step, like 12-step process and everything and everything. That is just
Right.
worsening. There is this what we call as acne cosmetica, which happens because
Hmm,
we complicate our regime. Okay, so first things,
hmm,
keep
hmm,
your regime very simple. Okay, that's
hmm,
most
hmm.
important. At the same time, I, as a dermatologist, usually what I do is that I add a face wash. Now, the face wash is not something like कि सबके लिए एक ही चल जाएगा नहीं. ठीक है?
Right.
It's totally based on the what type of skin you have got. If you have got a very oily skin or something like that, then I go for a salicylic acid based face wash. Okay, something like which is not much oily and everything. So then I tend to avoid salicylic acid. Okay, and
Hmm,
also the
hmm.
local weather matters a lot. Right now I'm in Mumbai. Okay, so Mumbai has got a very humid climate and everything. I
Right.
can go little overdrive on the face wash and everything, but I have to be
Hmm,
very cautious here also. But in
hmm,
Pune,
hmm.
like where I was practicing before, we had to take into consideration the winter and everything, where it was little not much, like obviously, but little severe winter. There, like
Right.
not everything suits everyone. That's the thing.
Hmm,
So face wash, as I said, like baseline is face wash. Be like something with the molecule, about the molecule, you should be using that molecule. Now, next is
right.
for the pimples. Now, for the pimples, usually if it's a very simple pimple, like just comedones, then just one medication. Okay, that what we call as keratolytic agents could be salicylic acid, could be topical retinoids in the form of adapalene, just one.
Hmm,
Okay, for such
right.
patient. Along with that, if there is something like they have got kind of like something like they have got of like kind of little dry skin, or it's winters. Okay, so moisturizers is something that I add. Okay, first
Hmm,
session is, then I tend to add a sunscreen. As the pimples reduces, I do add sunscreens, because the thing is I want to prevent the dark spots as well.
right.
So that's what I follow. Now, next is
Hmm.
when patients have got moderate pimples, okay, what we call as grade 2 pimples, okay, where
Hmm.
he or she has got pimples at the same time, comedons are there, but pimples, few pimples are there, not much deep, thoda bahut. Now, here, what I do is I tend to add two topical agents. Okay, so
Hmm.
face wash stays and moisturizer also, sunscreen also. But the thing is, just two topical agents. One most of the time is a anti-inflammatory antibiotic cream. Okay, something like clindamycin, benzoyl peroxide. That I tend to add. Now next one's grade 3, moderately severe. Something they have got 1 to 2 nodules. Here I tend to add isotretinoin. Okay, unless if the patient has got a lot of inflammatory lesions, a lot of inflammatory lesions, then I tend to add something what we call as oral antibiotics.
Right.
Okay,
So,
so and
these, yes, please.
yes, yes, sorry. So in grade 4, where the patient has got a lot of nodule cyst, I'm very scared to start directly like oral isotretinoin. There either I start them with topical antibiotics and oral antibiotics along with topical retinoids, but later on shift to isotretinoin. Or sometimes, depending on the condition, sometimes I add like a short course of oral steroids.
Right. Uh, Doctor, slightly deviating from the topic, will we now know that what kind of treatments one dermatologist normally takes?
Hmm.
But again, we would like to mention that please ये सारे जितने भी treatments के बारे में हम बात कर रहे हैं, you are supposed to visit a dermatologist for that. You please don't treat yourself. Uh, self self treating yourself, self medication can be very harmful when we are talking about your health, when we are talking about our skin. Please do not do that. It's always the best to visit your nearest expert. Again, doctor, what I was about to ask you, initially we were talking about oiling our hair. Nowadays we get to see that dermatologists, they are strictly asking us not to apply oil. पर हम तो हमें तो ये पता ही नहीं है, हम तो ऐसे बड़े हुए नहीं, हमने बचपन से सुना है कि तेल लगाओ, चंपी बहुत ज़रूरी है, एवरी अल्टरनेटिव डे यू शुड ऑयल और बिफोर
Yes.
you shampoo, you should oil your hair. This is what we have learned since childhood. So why this drastic change all of a sudden कि oil लगाना बंद कर देना है? Also, I have met a lot of people who are totally against it, especially the brands who are selling oil. Just imagine what kind of condition they are in nowadays. So why this change all of a sudden?
So yes, first of all, one point that you were saying, ki, yeah, I totally agree. Like you always consult your dermatologist before taking treatment, because the thing is that now it's not as simple as A plus B plus C works for
Hmm.
you,
Hmm.
so
Hmm.
it will work for
Hmm.
someone else. No, it for sometimes for
Right.
you it might be something like C plus D plus F, something like that. Okay, so not
Right.
everything, not all formula works for same person. Like it's different for each and every person. Yes. Now about the oiling. Okay, so even I am amongst those dermatologists who tell my patients not to use oil. Okay. Now, as
Hmm.
Indians, we love using oil. So the thing is that now one thing that we need to understand is that now that oil tends to stay on your scalp. Okay. It does not
Hmm.
penetrate a lot into the hair follicles. Okay. So that's the
Right.
reason. Other than that, like massaging and everything that we do, that tend to increase the blood supply. That is good. Okay, but the thing is that oil per se cannot penetrate inside your hair follicles. So getting some benefit using the oil other than massaging is not much. Okay, but
Right.
yes, oil is a very good conditioner. Okay, so it
Right.
tends to make your hair little less frizzy and everything. So basically, usually I tell my patients not to use oil at all. But if they are very
Hmm.
insistent, what I tell them is to just before bathing, 20 minutes before bathing, apply the oil only on your hair. Do not apply it a lot. Like sometimes I tell them not to apply at all. Sometimes they are very much insistent, very lightly, little bit, thoda sa lekar lagao sir pe. ठीक है? But tend to focus
Right.
more on the hair so that your hair like
Right.
you can derive the benefit of the conditioner, but at the same time do not harm your scalp ka whatever the biogen whatever the local environment it has got, so even that is not damaged. Okay.
Right. Um, right. So I think people who are watching us right now, a lot many people will be thinking against us or thinking कि ये कैसा बात है, not applying oil. I have been doing it forever, since forever.
Yeah, the
But
thing is,
yeah,
I was amongst them. Okay, so I
right.
totally
Even
understand that. But once I had attended a seminar and it just opened my eyes. Oh, I never thought like
right.
this. That was the thing.
Right.
So
right.
yeah, yeah,
So,
because
so also a
and
lot of things are changing. Let's also take nature for that matter. That the weather conditions are changing nowadays. The food which we are eating, those are changing nowadays. So ऑल इन ऑल सब कुछ बदल रहा है, समय बदल रही है और उसके साथ हमें भी थोड़ा-सा बदलाव लाना चाहिए इफ वी आर थिंकिंग कि बालों को बचाना है तो वी get to see tremendous hair fall nowadays. We hardly see people with long hair or thick hair. Everybody is suffering from hair loss nowadays. We are not talking about hair today, but because it's about skin, and somehow oiling is also related to acne. So tell us, doctor, can oiling also somehow trigger the condition?
so as I said, what happens is that the pores get blocked over this forehead
Hmm.
region. Okay, so because the pore get blocked over this region, that's the reason you tend to get pimples over this region when you apply a lot
Hmm.
of oil. So that's the reason. Okay, so that's the
Right.
reason we tell the patients to avoid oiling, especially once we see it now. And what happens is that now a lot of times schoolgirls, what I have asked the history and everything, and I have noticed is that ना कि स्कूल जाने वाले बच्चों के पास टाइम नहीं होता बाल धोने का, so they apply oil
Hmm.
one day, 2-3 दिन तक वही oil रहता है उनके सिर पे.
Right. I have done the same, yes.
Yeah,
So
so उसके
relatable.
वजह से there's this blockage of pores that happens, and then obviously they suffer a lot because of that. And
Right,
teenagers में
right.
self esteem issue बहुत रहता है, so they get very much affected by
Exactly.
that. So that's the thing.
Right. Uh, Doctor, again, if you're talking about skin, we have to talk about our diet. So, what kind of diet should one follow in order to resist themselves from having acne? And also, all the people who are acne prone, who has acne prone skin, what kind of diet should they follow?
Okay, so as you were saying कि आजकल हमारा डाइट बहुत चेंज हो गया है, ठीक है? So that is
Mm,
something right now also is contributing a lot to acne as well, ठीक है? So क्या होता है कि you should be avoiding milk and milk products, oily food, ठीक है? That is something very important. Sweets, okay? Because क्या होता है ना, sweets and oily food and everything, processed food जो भी होता है जिसका glycemic index ज़्यादा होता है, okay? There's
mm,
this kind of like that just like creates this imbalance, and suddenly there is this insulin like growth factors that gets increased. मिल्क एंड मिल्क प्रोडक्ट्स में भी ये बहुत कॉमनली होता है, एंड बिकॉज ऑफ विच वी टेंड टू डेवलप, बिकॉज द क्या हो जाता है ना कि जो मल्टीप्लीकेशन होता है स्किन के लेयर्स का जो दैट गेट्स
mm.
डिस्टर्ब, it starts multiplying
Right.
more, and because of which patients get a lot of oily skin because of that. Sometimes
Mm,
there are this contradicting research that is being like seen right now, one group of research, but most of them agree कि ये सारे food items can increase the acne. Okay, so that's the thing. So
right,
avoiding these food items plays a major role in reducing the acne. Okay.
right, right. What about alcohol and cigarette, doctor? Can these also trigger the condition?
So alcohol के ऊपर इतना I have not read about, but the thing is cigarettes has got a very contract, like it's got a kind of like a, what happens is that na, in cigarettes the research papers are kind of like split between the two, okay? They have
Mm-hmm.
found that ki do like consuming cigarettes in some patients has led to less acne. ओके, बट एट द सेम टाइम उनका जो पिंपल्स से ज्यादा जो कोमिडोन्स जो व्हाइट हेड्स होते हैं वो बड़े बड़े
Mm,
निकलते हैं, व्हाट वी कॉल एज मैक्रो कोमिडोन्स.
okay.
Okay, so those patients tend to have like patients who are smoking a lot and everything, they tend to have less of inflammatory pimples, but then they have a lot of non-inflammatory जो pimples होते हैं जो कि like basically what we call as blackheads and whiteheads. So whiteheads की जो size होती है
Mm,
वो थोड़ी सी बड़ी होती है, so that's the thing.
right. Um, for people who are watching this live and who are wondering कि इसके बाद cigarette पीना चाहिए, then please don't.
Don't do
Cigarette
it.
is anyhow harmful for your health. Just yesterday, I was watching a video
हाँ.
where, according to research, it has been proved कि औरतों में महिलाओं में सिगरेट पीना काफी बढ़ गया है लास्ट 10 years और से 2 decades में बहुत
हम्म,
ज्यादा बढ़ गया है उसकी वजह से जो असर पड़ रहा है इन द फ्यूचर जनरेशन की बच्चे बहुत ज़्यादा वीक पैदा हो सकते हैं या ऑलरेडी वंस दे आर हियर वो लोग एज़मेटिक होते हैं। तो ये सारी कंडीशंस उनमें बहुत ज़्यादा पाए गए हैं जस्ट बिकॉज़ ऑफ स्मोकिंग। सो
smoking.
again, as we all know, smoking one cigarette can reduce at least 11, I think 11 or 13 seconds of your life. So please, अपना जीवन थोड़ा सा ख्याल रखना चाहिए, एंड यू शुड डेफिनेटली स्टे अवे फ्रॉम सच स्टफ.
एक चीज पाने के लिए 100 चीज
मूविंग
खोना
अहेड.
नहीं है।
Right. Doctor, what about stress? Can stress also trigger the condition? एंड अनहेल्दी
डेफिनेटली।
लाइफस्टाइल, आजकल हम मोबाइल्स में मैक्सिमम टाइम रहते हैं, स्क्रीन के सामने मैक्सिमम टाइम रहते हैं. वंस वी आर इन द बेड, वी नीड आवर फोन्स विद अस. सुबह उठ के ही सबसे पहला चीज जो हम ढूंढते हैं वो है फोन. वी वांट टू चेक क्या क्या नोटिफिकेशंस आए हैं. सो लाइफस्टाइल बहुत चेंज हो गया है. स्लीप साइकिल लोगों का बहुत बिगड़ गया है with every passing day. So can these lifestyle changes, or as asked, कि stress क्या trigger कर सकता है इस condition को?
True, definitely. It can trigger. It has been found in research कि stress जो स्पेशली स्कूल गोइंग बच्चों के ऊपर एक रिसर्च किया गया था. सो दे हैव डेफिनेटली फाउंड कि स्ट्रेस प्लेज अ मेजर रोल, स्पेशली टीनेजर्स में या कोई भी. इनफैक्ट हार्मोनल एक्ने में भी, पीसीओएस एंड एवरीथिंग में भी इनडायरेक्टली स्ट्रेस कैन लीड टू एग्रीवेशन ऑफ पीसीओएस एंड एवरीथिंग, राइट. तो उसकी वजह से अगेन पिंपल्स कैन गेट एग्रीवेटेड. Okay. At the same time, diet, lifestyle में it's very important that especially in patients जिनका hormonal acne होता है, regular exercise helps them a lot. Okay.
Right.
So regular, consistent, like, every, like I tell my patients, minimal 45 minutes of walking to kijiye. No need of going to joining a gym and everything. At least start with the walking and everything. And once that, like, you have made an habit of it, एक दिन दो दिन जाकर कुछ नहीं होने वाला. It has to be consistent. ठीक है, कोई भी changes
Right.
in order to reflect on your skin, on your, like, on your pimples and
Exactly.
everything, it has to be
Mm,
consistent. ठीक है.
right.
Phones and
Right.
everything, because of sleep cycle disturb हो जाता है, everything हो जाता है, again stress and everything that gets contributed, cortisol levels से affect होगा, कुछ ना, everything can contribute at the end to the pimples. That's there.
Right. Right. Uh, right. Doctor, tell us what is the role of sunscreen. आजकल sunscreen के बारे में भी डर्मेटोलॉजिस्ट बहुत ज्यादा बात कर रहे हैं. इनफैक्ट दे आर कंटिन्यूअसली स्ट्रेसिंग ऑन द फैक्ट कि सनस्क्रीन यूज कीजिए, चाहे आप कहीं भी हो, घर पे हो, बाहर हो, आप कहीं भी हो. इट्स वेरी मच इम्पोर्टेंट टू यूज योर सनस्क्रीन, जस्ट लाइक ए डेली रूटीन. आपको इसे यूज करना है
True.
जैसे हम ब्रश करते हैं. सो इज इट ट्रू कि सनस्क्रीन सच में इतना जरूरी है अप्लाई करना, या इट्स जस्ट अ मार्केटिंग गिमिक जो सारे कंपनीज
See,
लेके आए
I
हैं
as
अभी?
a
बिकॉज
dermatologist,
बचपन में आई पर्सनली आई हैव नेवर heard my mom applying or asking me to apply sunscreen. The only brand I knew is Johnson's Baby. मैंने बचपन से वही चीज अप्लाई किया है बस. But nowadays parents are so much cautious कि ये लगाइए, इसके ऊपर ऐसे लेयर कीजिए. Tell us the role of sunscreen. What is the role of sunscreen
ओके,
exactly?
सो द थिंग इज ना कि देखो, हमारे जब हम छोटे थे तो हमारे टाइम पे तो व्हेन आई वाज बोर्न, आई डोंट थिंक सो कि इंडिया में इट बट देयर माइट बी सनस्क्रीन, ऐसा नहीं है कि नहीं है. बट द थिंग इज कि
हम्म.
पहले तो सनस्क्रीन्स के ऑप्शंस वाज नॉट अ लॉट. ओके. एंड
Right.
बहुत बार क्या होता था कि उस टाइम के जो सनस्क्रीन्स जो ओल्डर जनरेशंस के थे, बहुत बार वो पोर्स ब्लॉक करते थे, तो पिंपल्स बढ़ने के चांसेस होते थे. Right now, as we
हम्म.
are evolving, right now what is happening is that now specifically for acne prone skin के लिए a lot of sunscreen have come now. मैं अपने पेशेंट्स को what I tell them कि I show my pen का stand which has got like 10, 15, 20 pens. I'm like कि इससे ज्यादा मेरे पास सनस्क्रीन के ऑप्शंस है. ठीक है, जो सनस्क्रीन आपको पसंद है, आपको लास्ट अगर पिछले बार सनस्क्रीन पसंद नहीं आया, लेट मी नो. आई हैव सच सो मेनी ऑप्शंस दैट आई हैव राइट नाउ. बेस्ड ऑन व्हाट यू लाइक, आई विल गिव यू द सनस्क्रीन. ओके. सो दैट इज व्हाट आई डू यूजुअली. ठीक है. नाउ
Right.
बेस्ड, यस. सो फर्स्ट क्वेश्चन वाज कि क्यों हम सनस्क्रीन लगाते हैं. ओके. सो फर्स्ट आई विल टॉक अबाउट व्हाई इन एक्ने वी यूज सनस्क्रीन इज बिकॉज कि कई बार व्हाट हैपेंस कि वन थिंग इज दैट कि ना कि जो पिंपल्स होने के बाद जो काले दाग बनते हैं वो इंडियंस में बहुत कॉमनली बनते हैं. ठीक है, बिकॉज
Right.
हमारा जो स्किन टाइप है वो व्हाट वी से कि बहुत जल्दी उसमें टैनिंग भी आ जाती है. एट द सेम टाइम कभी भी कुछ लग जाता है, पिंपल इज अगेन अ काइंड ऑफ ट्रॉमा फॉर द स्किन. ठीक है, तो कुछ हो जाता है तो काला दाग छोड़ के चला जाता है. ठीक है, जो सन एक्सपोजर से और बढ़ जाता है. ठीक है, सो जिसके वजह से दैट्स अ रीजन एक्ने में आई डू एड सनस्क्रीन समटाइम्स. अगर बहुत सीवियर एक्ने है, 4-5 मेडिकेशन ऑलरेडी डाला हुआ है फर्स्ट सेशन में, फर्स्ट सेशन में अवॉइड, मे बी सेकेंड थर्ड जब फॉलो अप आते, आई श्योरली एड द सनस्क्रीन. ओके. नाउ क्यों सनस्क्रीन एज अ डर्मेटोलॉजिस्ट इन जनरल हमने ज्यादा यूज करना शुरू किया है, इज बिकॉज कि मेलाज्मा, ओके, इंडियंस में मेलाज्मा जो होता है जिसको हम छाया बोलते हैं, ठीक है, बहुत
Hmm.
कॉमन. That's the reason our mom's generation has got a lot of patients who have got melasma
Right.
and everything, right? So that's
Exactly.
the thing. Right now, we have an option of like, preventing like melasma ही क्यों? Freckles होते हैं, बहुत सारी चीजें,
Hmm.
cancers होते हैं. But the thing is कि Indians में थोड़ा सा cancer की tendency कम है. Okay. But
Hmm.
foreigners are more like into sunscreen and everything is because they can develop skin cancers and everything. Indians में ऐसा नहीं है कि नहीं होता, होता है, बट थोड़ा सा कम चांसेस होते हैं इंडियंस में. ठीक है, सो
Clue,
दैट्स
what can be the reason behind it? Can it be melanin? That can melanin
यस,
be the reason
मेलानिन हैज
behind
गॉट
it?
अ प्रोटेक्टिव रोल. मेलानिन हैज गॉट अ
Hmm.
प्रोटेक्टिव रोल. सो जिसको जो हम समझते हैं कि कोई भी इंसान थोड़ा सा लाइक टुवर्ड्स द डार्कर साइड रहता है, इन दैट वे दे आर ब्लेस्ड बाय द गॉड कि उनको प्रोटेक्शन मिला होता है.
Right.
दैट्स द
Right.
थिंग. So that's the thing. So Indians में थोड़ा सा स्किन कैंसर्स कम है, बट द थिंग इज कि सनस्क्रीन इज जरूरी हमारे लिए, ए लाइक टू प्रिवेंट कैंसर्स तो है ही, एट द सेम टाइम कि मेलाज्मा एंड एवरीथिंग जो भी है स्किन रिलेटेड डैमेजेस उसको प्रिवेंट करने के लिए.
राइट. डॉक्टर अगेन इसी टॉपिक में थोड़ा सा बात करेंगे हम. मेलानिन
हम्म,
के बारे में हम बात कर रहे थे. आजकल थोड़ा सा ऑब्सेशन है. वी लेट्स अग्री कि इंडियन को थोड़ा सा फेयर स्किन से ऑब्सेशन है. एवरीबॉडी वांट्स अ फेयर स्किन. उसके लिए कितना प्रोडक्ट्स अप्लाई कर रहे हैं, व्हाटसोएवर दे आर डूइंग, ओनली दे नो. बट है, ऑब्सेशन है. तो अभी देयर आर दिस प्रोडक्ट्स अवेलेबल इन मार्केट. ग्लूटाथायोन अवेलेबल है, जिससे डर्मेटोलॉजिस्ट सजेस्ट करते हैं कि स्किन टोन फेयर होते हैं एक दो शेड. बट बताइए, क्या स्किन कैंसर की संभावनाएं बढ़ जाती हैं इससे?
माई थोड़ा सा बढ़ सकता है बिकॉज टेक्निकली यस लाइक बट वही है कि चांसेस कितना, मतलब बिकॉज द थिंग इज कि देखो आपको एक चीज समझनी पड़ेगी. आई एज अ डर्मेटोलॉजिस्ट आई डू नॉट प्रमोट ग्लूटाथायोन एज अ स्किन लाइटनिंग एजेंट. आई प्रमोट इज एज अ
हम्म.
स्किन ब्राइटनिंग एजेंट. डिफरेंस है थोड़ा सा
ओके.
why, because yes, see, glutathione का जो ये था, जो discovery था, was an accidental discovery because it was given in cancer patients. It's a very powerful antioxidant. ठीक है, when it was given in
ओके.
cancer patient, it was seen that कि उनका थोड़ा सा skin tone light हो गया. ठीक है, and then there was this obsession of using that, and because obviously there is this stigma that's seen in like in our culture, not even in our culture only, like in Asian culture. ठीक है,
राइट.
so that's the thing. Me as a dermatologist, I do not like there like sometimes patient do come for like हमें गोरा
हम्म.
होना है, and I always tell
हम्म.
them to see गोरा होने के लिए भी सी व्हाट इज योर बेसलाइन स्किन टोन, उतना तक हम पहुंच सकते हैं जो धूप से लाइक धूप से थोड़ा बहुत टैनिंग तो होता ही है. ठीक है, उससे
राइट.
नीचे अपना नेचुरल जो स्किन टोन होता है उधर तक हम अचीव कर सकते हैं, पर उससे
हम्म.
ज्यादा अचीव करना इज ए अननेचुरल एंड बी नॉट गुड फॉर
हम्म.
यू. ठीक है, एंड
राइट.
तीसरी चीज ये होती है कि देखो ग्लूटाथायोन gives you, it's a powerful antioxidant, it has got its own benefits and everything, I agree, but just to
हम्म.
become bright weekly, whatever the monthly sessions, for me it's kind of like brightening के लिए ठीक है, pre bridal and everything okay, but
हम्म.
not for this. I will totally say no to that. And cancers का
राइट.
देखो, कैंसर से ज्यादा ना the thing is कि ग्लूटाथायोन का कैसे होता है
हम्म.
कि that's the thing कि हो गया, यू अचीव द
हम्म.
स्किन टोन. ठीक है, उसके बाद
राइट.
अगेन इफ यू स्टॉप डूइंग इट, वापस से वो चला जाता है, इट बिकम्स लाइक कम्स टू बेस लाइन. ठीक है, उससे ज्यादा अच्छा
हम्म.
have a regular skincare. A regular skincare does wonders. Use sunscreen
राइट.
so that you are maintaining
राइट.
whatever the skin tone, like tanning and everything thoda sa kam rahe. Whatever, like always use photo protection method, like sun protection methods जिसको हम बोलते हैं, जैसे कि बाहर जाने के
राइट.
टाइम छाता यूज करो, cover your face whenever you're going out, use like an hand,
राइट.
wo better hai. Like that is something,
राइट.
yes, it is not going to give you a quick result, but it's a lifestyle changes that you do that will help you,
राइट.
achieving a good skin, at the same time protecting you from the sun.
राइट. राइट. बहुत बहुत अच्छा बात किया कहा डॉक्टर आपने. बट आई ऑल्सो नो लॉट ऑफ पीपल who are consuming such products on their own without any expert suggestion. So, can consuming such products for a long period of time somehow affect the health?
See, that's the thing. Now, glutathione का it's like कि देखो oral जो glutathione रहता है ना, see most of it it's not very much well absorbed in your body. ठीक है? So that's the
Hmm.
reason IV देते हैं. ठीक है? Now even in IV ना, it should be under a proper dermatologist or proper like health facility. Why is that ना? कि
Right.
sometimes patients just take आजकल मैं I have seen कि parlors में भी start हो गया है. ठीक है? But the thing is that that's an IV thing, right? सो कई बार देर इज समथिंग व्हाट की लाइक पेशेंट कोलैप्स हो जाता है कुछ हो जाता है देयर इज नो मेडिकल फैसिलिटी एंड एवरीथिंग एंड दैट इज लिटिल
Hmm.
स्कैरी लाइक
Very scary. It's very
या
scary. Uh,
या दैट्स द थिंग
पार्लर्स
एंड
पार्लर्स के बारे में डॉक्टर आपने कहा बहुत नॉर्मल है फेशियल हम सभी करवाते हैं वी
यस
ऑफन डू विजिट द पार्लर अगेन कमिंग बैक टू द सेम पॉइंट एक्ने के बारे में डॉक्टर इज इट सेफ टू विजिट सच पार्लर्स एंड गेटिंग फेशियल्स एवरी मंथ नॉर्मली उनके प्रोसीडियर्स में बहुत सारे इंस्ट्रूमेंट्स टूल्स भी यूज होते हैं जिससे वो ब्लैक हेड्स वाइट हेड्स रिमूव करते हैं सो कैन दोज प्रोसीडियर्स समहाउ ट्रिगर द कंडीशन
So the thing is that na see this is little controversial but the thing is that na first of all parlor में अगर आप कुछ कर रहे हो see to it that you do it something that is not very that is something not very strong or something ठीक है जिससे क्या हो सकता है ना अगर चीजें strong होती है something like you are using a very strong agent ठीक है burn के
केमिकल
chances
ट्रीटमेंट
yes
राइट
peels I as a dermatologist use it the thing is the peel का concentration जो होता है ना वो बहुत strong होता है ठीक है सो यू हैव टू कीप ऑब्जर्विंग मे बी 100 पेशेंट्स में कुछ ना हो बट वो एक पेशेंट रहता है जिसका चेहरा जलने के चांसेस होते हैं एंड अदर थिंग इज दैट ना कि क्या हो जाता है कि पार्लर में अभी आप बच्चों बता रहे थे व्हाट वी कॉल एज कोमिडोन एक्सट्रैक्शन ठीक है अब क्या हो जाता है कि अ पर्सन नीड्स टू नो कि कौन से कोमिडोन को उन्होंने एक्सट्रैक्ट करना चाहिए ठीक है कई बार व्हाट हैपेंस इज दैट ना कोमिडोन एक्सट्रैक्शन में फर्स्ट ऑफ ऑल द स्किन शुड बी प्रेप्ड का मतलब ये होता है कि हम डोमेटोलॉजिस्ट हमेशा पेशेंट्स को बिफोर डूइंग ऑल दिस प्रोसीजर्स कुछ क्रीम्स देते हैं सनस्क्रीन्स ऐड करते हैं ये सब कुछ करते हैं सो दैट उनका जो चेहरे पे जो भी है अगर हम उसको एक्सट्रैक्ट करें वो ए इजीली एक्सट्रैक्ट हो जाए बी इसके कोई काले दाग ना रहे parlor wali auntie will not ensure that right so what happens is
राइट
that na they tend to know not to know where to apply the pressure okay so sometimes what happens is that na if you apply a lot of pressure over a pimple it can burst inside only and उसके वजह से बहुत बड़ा एक जो पेशेंट को was not supposed to get a nodule will end up getting a nodule and उसके बाद उसका scars अलग बन जाएगा and I as a dermatologist I'm scared about the scars because scars के लिए
राइट
कोई creams नहीं आता you have to go for the procedures
राइट राइट सो इसके साथ हम ये भी कह रहे हैं कि अपने एक्ने में प्लीज आप कोई नेल्स ना लगाए या खुद से प्लीज आप कोशिश ना करें उसे स्क्रैच करने का उसे पॉप करने का डू नॉट डू दैट इट कैन बी द वर्स्ट थिंग यू आर डूइंग टू योर स्किन डॉक्टर आई कैन सी फ्यू क्वेश्चंस कमिंग अप फ्रॉम द व्यूअर्स इतने सवाल है आज हमारे पास कि आज ये लाइव लग रहा है एक्सटेंड करना पड़ेगा सो द फर्स्ट क्वेश्चन कम्स फ्रॉम प्रवीण हु आस्क्स डज वॉशिंग माय फेस help acne?
सो द थिंग इज कि इससे यू कैन एक्चुअली वर्सन योर एक्ने एज वेल ठीक है क्यों
Hmm.
क्या हो जाता है ना कि दिस व्हाट वी कॉल एज एक्ने डिटर्जेंट ओके वेयर पेशेंट इज इन द होप कि मैं बार बार चेहरा धोऊंगा पिंपल चला जाएगा ठीक है इसकी वजह से क्या हो
Hmm.
जाता है कि जो स्किन का जो बैरियर रहता है ना वो डिस्टर्ब हो जाता है ठीक है एंड बिकॉज कि बहुत बार सोप्स जो यूज करते हैं इट्स समथिंग लाइक अ लोकल जो भी सादा सा एक सोप मिल जाता है लाइक आई विल नॉट टेक द ब्रांड नेम एंड एनीथिंग जो भी लाइक हम लोग बॉडी सोप जो यूज करते हैं वही 10 to पेशेंट्स वही यूज कर देते हैं थिंकिंग कि वो दैट
Hmm.
विल हेल्प देम क्या हो जाता है कि इसका पीएच बैलेंस नहीं होता ठीक है टुवर्ड्स अल्कलाइन
Hmm.
होता है जिसकी वजह से ये जो पिंपल्स होते हैं वो बढ़ने के चांसेस होते हैं ठीक है सो
Right.
दैट्स अ थिंग कई बार डूइंग अ लॉट ऑफ थिंग्स कैन वर्सन द पिंपल्स ठीक है सो दैट्स
Right.
अ थिंग
Right. यस अगेन कुछ भी आप कर रहे हैं अगर आप देख रहे हैं आपका स्किन थोड़ा सेंसिटिव है रिएक्ट करता है जल्दी आप प्लीज अपना खुद का जांच खुद ना करें प्लीज मेक श्योर आप एक्सपर्ट के पास जा रहे हैं क्योंकि उन्होंने ऑलरेडी वो कंडीशन देखा है पहले दे नो हाउ टू डील विद इट प्रॉपरली better than you of course so please make sure आप अपने एक्सपर्ट के पास जा रहे हैं whenever you see any changes in your skin ऑल्सो इसी के साथ वी सी अ लॉट ऑफ पीपल हु आर लीस्ट बॉदर्ड अबाउट द स्किन उनको कोई फर्क नहीं पड़ता है क्या हो रहा है क्या नहीं हो रहा है दे थिंक कि अपने आप से ठीक हो जाएगा सो व्हाट इफ somebody is prolonging the condition डिले डिले होने का क्या क्या असर दिखता है हमारी स्किन पे?
तो द थिंग इज कि सी जैसे मैं आपको बता रही थी कि मुझे पिंपल से इतना डर नहीं लगता जितना मुझे स्कार से लगता है. ओके.
हम्म.
सो द थिंग इज दैट ना प्रोलॉन्गिंग द ट्रीटमेंट व्हाट हैपेंस अ लॉट ऑफ टाइम्स कि ये पिंपल्स अनट्रीटेड रह जाते हैं. सो देयर इज अ लॉट ऑफ डार्क स्पॉट्स दैट स्टेज ऑन योर फेस. ओके. ठीक है. सो अ
हम्म.
लॉट ऑफ डार्क स्पॉट्स इज देयर एंड अ लॉट ऑफ डार्क स्पॉट्स दैट कम्स अप ऑन योर फेस. सो दैट्स द रीजन वो एक कॉम्प्लेक्स फिर प्रॉब्लम बन जाता है. सो आप जितना ट्रीटमेंट डिले करते जाओगे उतना मेरा काम ज्यादा बढ़ता जाएगा. ठीक है. And the thing is treatment becomes more and more like you can say I have to add a lot of agents kind of thing, just to treat it. मतलब आपका कंडीशन जो एक महीने में ठीक होने वाला था, you're just making it increasing the prolonging the time duration of the treatment. So that's the thing.
Right, right, right. With that, doctor, we'll quickly dive into the next question, which comes from Ashish. पूछते हैं, what is the role of bacteria in acne?
So the thing is, there is this particular bacteria that's there. Okay, what we call as इसका नाम चेंज होता है. ठीक है. So it's called Propionobacterium acnes. Okay, अभी Cutibacterium acnes. I guess there's one more name that has come up right now. ठीक है. So that's the
Okay.
thing. ये जो होता है, so what happens is that ना जो sebum होता है, जो हमारा sweat whatever that pilosebaceous unit जो जो ग्लैंड होता है वो सिक्रीट करता है. उस पे जाकर ये जो बैक्टीरिया है वो जाकर एक्ट करता है जिसके वजह से इन्फ्लेमेशन आ जाता है. सो एक ब्लैक हेड एंड व्हाइट हेड जो होता है दैट इज लाइक राइट नाउ उसमें कोई इन्फ्लेमेशन कुछ नहीं होता. बट बिकॉज द बैक्टीरिया कम्स एंड एक्ट्स ऑन इट, दैट्स द रीजन देयर इज दैट पिंपल दैट डेवलप्स.
Right.
ओके. एंड देयर
Uh,
इज वन मोर ग्राम नेगेटिव फॉलिकुलाइटिस करके भी एक चीज होती है जो अ डर्मेटोलॉजिस्ट इज द बेस्ट पर्सन टू डिफरेंशिएट बिटवीन द टू.
mm-hmm.
लाइक दैट्स द थिंग.
Again, yes, I believe Ashish, you have got your answer. The next question comes from Firoz, who asks, how does humidity affect acne?
So increase in humidity can lead to increase in oiliness of your skin. That's the reason there's more of acne that happens in humidity. So there's this term what we call as acne aestivalis, where it was seen कि जो मेलोर्का एक रीजन है स्पेन में जो बीच के लिए फेमस है. तो वहां जब भी वेकेशंस के लिए जाते थे तो a lot of people used to get acne because the thing is they used to go from a non like a low humid area से high humid area पे चले गए. So yes, humidity can lead to
Hmm.
worsening of the pimples.
Right. The next question comes from Anuj, who asks, how can I reduce acne inflammation?
First, consult your dermatologist. That's my thing. Yeah, खुद से कुछ मत कीजिएगा. But I, as a dermatologist, use what we call as anti-inflammatory medications, sometimes antibiotics, because इसमें role of bacteria तो है ही. So I use that.
Hmm.
Now, based on the degree कितना है, so I will give either topical or oral.
Right. And the last question comes from Reena, who asks, is it safe to use retinoids for acne?
Again, same. Let your dermatologist decide कि आपके लिए रेटिनॉइड सेफ है कि नहीं. Why? Because sensitive skin के लिए you have to be very careful when you're adding retinoids because sensitive. See,
Mm-hmm.
the thing is, I'll give you my example itself. ठीक है. I have got a very sensitive skin. जब मैं नई नई रेसिडेंट बनी थी, so I used to बहुत रहता है कि नया क्रीम्स आया, लेट्स ट्राई एक पिंपल लेट्स ट्राई. ठीक है. So I
Mm-hmm.
tend to get worsened with retinoids. You know, I got a lot of layer of pimples during my first year, second year. Then I realized कि what I'm doing is acne cosmetica वो हो रहा है मेरे साथ. So that's the thing. So yes, it is safe, but under a hand of under the guidance of a dermatologist.
Right. Doctor, जाते जाते please tell us a little bit more about collagen. क्या आजकल लोग बहुत ज़्यादा कंज्यूम कर रहे हैं? So, can it help acne as well? क्या है फंक्शन कोलेजन का?
सो कोलेजन जो होता है ना, आई वोंट बी मच श्योर कि वो एक्ने में हेल्प करता है बिकॉज द थिंग इज कि
हुँ, हुँ,
acne is something which happens over the upper layers of this, कि you can consider थोड़ा सा epidermis के layer में थोड़ा बहुत deep dermis is also there, but it's the gland का thing that is happening. Collagen is more for aging के लिए right now it's been promoted. At the same time it's been promoted right I can think in acne in this case of acne scars. ठीक है.
हुँ,
कि एक्ने किसी पेशेंट को ऑलरेडी एक्ने स्कार हो गया तो उस जगह का थोड़ा सा कोलेजन इज थोड़ा सा टीदर्ड हो गया या फिर वहां उस जगह पे कोलेजन लॉस हो चुका है. सो इन दैट केसेस थोड़ा बहुत कोलेजन हेल्प करता है. ठीक है. बट द थिंग इज राइट नाउ it's like there's a kind of big, like, debate going on whether the collagen is really beneficial for you or not. Okay, but one thing
Hmm.
everyone
Hmm.
agrees is कि collagen is there na, it's an animal protein. ठीक है, so उसका जो source होता
Right.
है that should be an animal derived. There's a lot of market में आजकल थोड़ा सा gimmick जैसा चल रहा है कि
Hmm.
vegetarian collagen भी बोल रहे हैं, which is not a good thing.
Hmm. Hmm.
ठीक है,
Right.
कि वो राइट,
Right.
तो मरीन कोलाजन इज देयर, एनिमल बेस्ड, लाइक सी वी
Exactly.
इंडियन,
Hmm. Hmm.
like
Hmm. Hmm.
एनिमल बेस्ड
Right.
कोलाजेंस जो होते हैं यूजुअली दैट इन्वॉल्व्स बीफ एंड एवरीथिंग, बीफ पोर्क, कुछ ना कुछ उसको इन्वॉल्व करते हैं. सो राइट नाउ इन इंडियन मार्केट्स में मरीन बेस्ड कोलाजन चल रहे हैं, सो दैट्स ओके. ठीक है,
Right.
एंड लाइक Koreans and all, they tend to consume a lot of bone broth and everything, जो
Hmm. Hmm.
beef broth होता है basically, उसका जो bone, ये they say that's the thing. The
Natural
supporting
source
is
है.
that
Right.
they have got a really good skin and good skin texture and everything. So, but yeah, we can't, I as a, personally, I don't have
But we
opinion.
have to agree कि इसमें जीन्स का एक बहुत इम्पोर्टेंट रोल है. द मेन रोल प्लेड हियर इज बाय द जीन्स. तो आप किसी प्रोडक्ट पे, किसी एडिबल पे आप डिपेंड कर ही नहीं सकते हो यहाँ पे.
नहीं कर
क्योंकि
सकते.
सब आपके जीन्स में आ चुका है ऑलरेडी. जनरेशंस आफ्टर जनरेशंस, years आफ्टर years इट हैज बीन देयर. सो ये
Yeah.
अचानक से आने वाला चीज नहीं
नहीं.
है.
तो हमारा और कोरियंस का, the thing is कि see, they are really good at it and everything, but their genes are little
Hmm.
different than us. So
Yeah,
you
of
are right
course, of
about it.
course. Yes, yes. Well, we had a wonderful discussion today, Doctor, on topic, off topic. It was very interesting. Before we take a leave, any take-home message for our viewers who has watched us so far?
So the thing is, for the take-home message, I guess I'll focus more on the acne only. Okay, so
Hmm.
first of all, my thing is ki acne is not something that is easily been treated, easily been treated by yourself. Not all formula works for everyone. Okay, it's not as simple as that, so it requires a holistic approach. Okay, at the same time, patience. Okay, holistic approach in the sense ki lifestyle modifications, diet, everything plays a role in that. Okay, at the same time, जो medications रहते हैं, let your dermatologist decide, and at the same time be patient with the medication. The consistency is the key in this one. Okay, and the thing is, it's a chronic condition, it is going to take its own time. Yeah, but at the same time we need to maintain the condition so that you maintain
Hmm.
a good skin and everything, so that dark spots and scars is also prevented with this. Okay, so that's the thing, start with the medication but have patience. That's my thing.
Well, that was the expert advice for today, and that was Dr. Nandini Shetty for us. Thank you so much, Doctor, for your valuable time. It has been a very
Thank you.
informative session for our viewers today, and it was great to hear from you. We look forward to many more such sessions in coming time. Also, thank you, viewers, for your excellent participation. For more information and update, stay connected on our page, Beautiful Spotless Skin. We are also available in Facebook, YouTube, and Twitter. Thank you. Stay safe and stay healthy.